Hello, everyone, and thank you all for coming. My name is Olivia Doe, and I am a mental wellness ambassador. I work with Somerville Department of Health and Human Services as well as teen empowerment. In the United States, there are 10 times as many people with mental illness in prison than there are receiving treatment in state hospitals. So let's start off with a little experiment. I'm going to say a few statements, and I want you to raise your hand if the statement applies to you. You or someone you know has been affected by mental health in some way. That's a lot of hands. You or someone you know has been in prison. You want to know what you can do to make a positive change on this issue. So we're basically unanimous here. Thanks everyone for participating. We can see that this is an important topic, but one that doesn't get talked about enough. My role as a mental wellness ambassador is to end stigmas about mental health. And we create events to discuss these issues. This event, my inspiration for this event happened when I spoke to a man who didn't get help for his opium addiction because there was marijuana in his system. What separated this man from getting help in that rehab center or any other center in Massachusetts was that he was formerly in a prison system. So this made me curious. How does the system work? Who has the power? What is it like to be in the system, and how can we help? We want to acknowledge that this event is limited in scope and is only a small part of a much larger conversation. We encourage the audience to continue the conversation, and we would love to be involved in conversations that have perspectives not represented today. Thanks to the advising and the hard work of our partner SCATV and especially Erica Jones, we are lucky enough to welcome our panelists who can help us answer these questions. First, we have Renée Portanova, the co-founder and director of the New Garden Society, a nonprofit organization that provides therapeutic and vocational horticulture training. She works with host agencies to design and implement programming that supports participants' well-being, existing treatment plans, and goals for positive behavioral change. Next, we have Brandy Henry, LICSW, a PhD candidate at Brandeis University, Heller Keller School for Social Policy, and a licensed independent clinical social worker who has provided direct clinical services to patients in the Massachusetts prison system. And last but not least, Keith Anderson, a Somerville native who has spent time in jail. He is a substance abuse clinician at Norfolk County Sheriff's Office and a licensed alcohol drug counselor with 10 years experience in the substance abuse field. Now I'm going to pass it over to our moderator and my coworker at Teen Empowerment, Sean Post.
Awesome. Woo woo. Thanks, Olivia. So we're going to start off the discussion with a section where me and Olivia are going to ask the panelists questions that'll give us a foundation of who they are, where they work, and how they got into that work. And the goal of this section is to set us up for the open Q&A that's going to happen so we can ask more informed questions when that comes up. So let's start with Brandy. Could you give us a walkthrough of what procedures, screenings, and resources an average inmate would receive?
Sure. Okay, so I'm going to break this down for the Massachusetts Department of Corrections because there's a federal system and a jail system, and they all kind of have their own way of doing things, but I think it's, from what I understand, fairly similar. So when an inmate comes into the Massachusetts Department of Corrections, they go to the intake center where they receive a screening upon entry. And that screening includes questions about mental health history, mental health symptoms in the past that they may currently be experiencing, medications that they may have been on or may be on now. and also questions about trauma or sexual abuse history, which are used to get a perspective of the person's mental health, but also for housing purposes in terms of determining like who might be at risk and where they should be living. So at that point, the person also generally receives a mental health appraisal. That doesn't have to be done for 14 days, but usually it's the same person who does both things, so usually they just do it at the same time. So the person who's doing these evaluations is a qualified mental health professional. That's what they call them in the policy, but that's basically someone who either has a doctorate or a master's level psychology or social work degree with the appropriate licensure. So then after that appraisal, the person will either be deemed to have a mental health diagnosis, in which case they will be, will have an open mental health case. If they don't appear to have active symptoms or need active treatment at the time, they'll have a closed case. And so the person at any point after that can be rescreened, reevaluated, and opened. That would either happen through self-referral from the inmate themselves or from another staff member, mental health or correctional medical staff. And so those 6 slips, they need to be followed up within 5 days, unless they're like a crisis level sort of thing, like I want to die, that receives immediate attention. Once the person is open, they're followed every 30 days for individual therapy, and then every 90 days for medication management if they require that. And so that's just the basic level of services. The mental health services within the prison facility, it's modeled after the same that you would receive in the community. So there's outpatient level, which is what I just described, and then there's sort of partial hospitalization, residential type treatment that also exists within the prison system here in Massachusetts. So they have designated units with more intensive treatment. So those people are seen more frequently. They receive group therapy, usually daily. It's up to them. They sign up for their groups and how many they want to take. And then there's inpatient level hospitalization, which is then at Bridgewater State Hospital. So there's sort of the whole continuum of care. And then if you are interested in like learning more details, all of these policies are publicly available through the CMR 650, which you can get online. So all the things I described in more detail, they even have like the forms that are used to evaluate people, that's all publicly available.
Awesome. Thanks, Brandy. That's the next question.
Keith, this one's for you.
Okay.
This is a 2-part question. What was your perspective on mental health services in jail while you were inside, and has it changed now for prisoners inside?
Well, from my perspective, when I was inside, a lot of the time I wasn't really seeking help while I was locked up. The few times that I did try to go for treatment, a lot of it was for like the mental health aspect was for substance abuse related, and there were programs available and things like that. I think now, years later, things have evolved, and there's a lot better services, especially where I work now today. There's I see clients coming in there, inmates coming in there, and they're meeting with mental health clinicians, every other week, having one-on-one sessions. That's something that I didn't see when I was doing time. But then again, when I was doing time, I wasn't really a model inmate, and at the time I really wasn't looking for a lot of help, so it's but I think that it definitely has evolved, since I've been out of jail since 2003, so it's definitely a little bit different now.
Thank you.
So, Renee, what are some of the challenges to achieving success in your work, and what are ways you measure success? And also, do you have any specific stories that stand out to you?
Sure. Let me take a step back and tell you a little bit about the programming. We provide year-round horticulture vocational training, and it's classified under therapeutic horticulture. And our participants start with a winter intensive for 6 to 8 weeks, and then it's followed by a field component. One way that we evaluate the program is by taking attendance to look at the retention rate and determine if there's been a lot of attrition. We also do a pre-test and a post-test to understand whether the core concepts in horticulture are being communicated and learned, and whether the participants in the class can apply those concepts to real-life scenarios. At the end of the programming, we sit down with our host agencies and review the season and determine with them what kind of improvements need to be made moving forward. So that's another assessment tool. So both qualitative and quantitative.
Awesome. Thank you. And I'm going to apologize here. I got very excited to start asking questions. I skipped a step. I would love to hear from Brandy and Keith just an overview of what is the work you do and how you got into that field. So we can start with Brandy.
Sure. So currently I'm a PhD student, so I'm working to study policies and how they impact direct patient outcomes. And I got to this point in my career on this sort of trajectory. I started in direct service provision, so until this past summer I was working within the prison system providing clinical services. And I started that work in outpatient, actually. I was working at a community mental health clinic. I was very interested in psychology stuff in high school. I thought that'd be really cool, and I actually really did enjoy it while I was doing it. And I wasn't specifically interested in this sort of intersection with criminal justice. I was more just kind of focused on like severe and persistent mental illness. But I got into this sort of intersection because the agency I was working for took a contract to provide case management for the county for people who were conditionally released from forensic facilities. And so I really didn't want to do it. I was really mad that they took this without, asking me. So I didn't want to work with those people. And then once I worked with them, I was, shocked, horribly so, to realize that they were just like everybody else I was working with, except for they had this whole other component to their lives that was very complicated and really unjust. And so they, told me stories about where they had been through the system, and I just got really interested in kind of going down this rabbit hole. And so I've worked, I did that for a while. I worked in a forensic hospital, and then I worked in the prison system here. So I've sort of seen the whole thing. And then my idea was to get a perspective of what the issues were and then step back and try to address them through policy. Because I felt like if I didn't have a good understanding of what the issues were on the ground, that I couldn't come from an authentic place in trying to fix the issues.
Thanks, Brandy. So Keith, you want to talk on that same question? Just what's the work that you're doing, and how'd you get involved in that work?
Sure. Well, first off, I think it's important to say that I'm a person in long-term recovery, and what that means is that I haven't had a drink or a drug since May 2003. And I was actually incarcerated the last time that I did use. In October 17, 2003, I got out of jail. I ended up in the Brockton area. And, I had been in and out of jails or institutions since the age of 13. Addiction, ran through my family, and, so that's all I knew. I ended up in a new area. I finally was able to humble myself enough to surrender and ask for some help. And, for the first few years, I had to persevere through not having a license and asking other people to get me to work and different things like that. I ended up getting into the substance abuse field in 2005, and I worked as a unit associate for a program called High Point. And basically what I would do is just take guys outside for smoke breaks and bring them to classes and so on and so forth. And when I started doing that, I just fell in love with it. And that started my career, as a substance abuse counselor. I went back to school. I got licensed in 2006 as a alcohol and drug counselor. I recently went back, got my bachelor's, and I got that in this past May. About a year ago, I seen an ad ran through Bay State. I currently work for Bay State Community Services, looking for a substance abuse clinician at the Dedham House of Correction. And I thought to myself, well, why not? I might as well, give it a try, see what happens. But I honestly didn't think it was going to happen. It's kind of a long story. I won't get too far into it. But at first they denied me because of my Corey. And I knew some people that were working in there that were also clinicians that I've worked with at other agencies. they vouched for me, and they called back. I went in and I had an interview, and I've been there ever since. And, you know, it's so what I do in there now is I do one-on-one counseling with inmates. I primarily work on a drug unit and provide counseling. I do relapse prevention classes, aftercare planning classes. So just preparing people mentally, you know, for when they get out into society, and, you know, what to expect, and you know, and all those kinds of things. So that's what I'm doing now, Sean.
Awesome, thanks.
Yeah, thank you.
And Renee, do you want to add anything? You kind of caught the introduction there.
Sure. So my day job is working as the horticulture manager for the Esplanade Association on the Charles River Esplanade. And I worked there in collaboration with the Department of Correction, I'm sorry, the Department of Recreation at, what's the other word? Conservation and Recreation. I hope that part gets edited. And then DCR, exactly. And then in my spare time, along with my business partner, Erica Rumbley, we co-founded and direct the New Garden Society, which I already stated. We work in 2 medium security prisons here in Massachusetts. And we this season we also did our first pilot program for the Department of Youth Services.
That's great. That's great. Renee, or Brandy, is there anything you've learned from your studies and work that may be surprising?
Yeah, I think there's probably a lot of things. One of the things I think most people assume is that people who are incarcerated are there because they're guilty, which actually in the county jail system in the United States is not really wholly true. Some estimates have put the unsentenced awaiting trial population at twice that of the sentenced population, which I think it just doesn't seem right to most people. And so then you wonder, well, you know, if they're in there, it must be because they were remanded without bail, they've done something horrible. That's also not really true. Of course, that exists, but also, for the most part, it's people who can't afford to pay their bail. And it's not necessarily even high bail. It could be bail that's $50, and people still can't afford to pay it. So there's sort of this almost like a debtor's prison system going on within the county jails. And so part of what I do on the side is I'm also a steering committee member on the Massachusetts Bail Fund. So we post bail for indigent people up to $500 to try and sort of fit, make up for these inequities in the system. But that's definitely not a solution. There's some legislation in some places and some lawsuits that are trying to address these issues, but it's kind of something that really, people don't expect or assume isn't really happening.
Awesome, thank you. So back to you, Keith. I know you have a lot of experience working with substance abuse. What would you say is the relationship between substance abuse and mental health?
I think they're one and the same. I think that for me, I don't see too much of a separation. I mean, when you're dealing with substance abuse, you're dealing with obsession and compulsion, and it's a mental illness. It's a mental sickness. And I think, a lot of the clients that I serve, I'd say, to pick a number out, I'd say 70% have a co-occurring mental illness, whether it's depression, anxiety, PTSD, some related from PTSD or bipolar disorder or something like that. And whether or not that came first and then, they started using to self-medicate, or it developed through active addiction, or where it came from, is unknown. But, I definitely think that both of those things are so closely, tied together. Like I said, they're one and the same as far as I see it.
Thanks, Keith.
And to close off this section, Renee, where do you see therapeutic treatment heading in the future?
I know for the New Garden Society specifically, our long-term plans are to start working with populations as they come into reentry. There's a lot of evidence out there that is suggesting that when people have exposure to vocational training and a support network when they reenter into society, and a bridge to a career and a job, then they're less likely to be reincarcerated. So with the New Garden Society, we're hoping to partner with agencies that will allow us to work with people as they enter back into society.
And
Sure.
how do you volunteer, like to?
For the New Garden Society, to work in the prisons. So we originally got started because the DOC put out a request for volunteers, specifically in horticulture. If you go to the DOC website, there's a whole list of volunteer opportunities within the Department of Corrections, and we answered that unmet need, and from there it's grown. And the first 2 years that we were around, it was just Erica and myself, and now we have 2 other volunteers that are coming into the prisons as representatives of our organizations that's facilitating our programming.
Thank you.
All right, thanks guys. So we're gonna do another short segment, and we're gonna ask some questions that are open to all 3 panelists. So we can do, if one of you wants to take it, or if all of you have a comment, that would be awesome. So the first question is gonna be, do you believe anything should be changed about how the prison system handles its inmates' mental health? So that's wide open if anyone wants to go for that.
I'll say something about that. Like I said, I think that they definitely have come a long way. I think that more mental health providers need to be present in the jails. I think, hiring more mental health providers, more substance abuse programs. The main thing that I think that I myself am looking into is reentry, like there was talked about already. I think the more emphasis on reentry and having proper step downs. And I know that also has come a long way, since when I was doing time. But there's still a long way to go on that, and I think that people are aware of it now, and it's being talked about, it's being brought up. I just watched a documentary on HBO on Vice on it. So this is something that's people are starting to talk about, people are starting to become aware of, and I think I'm hopeful for the future, as far as reentry services and things like that. And one of the things that I would like to see would be residential programs, 4 to 6 month programs, that usually would be referred to as halfway houses, be opened up primarily for guys coming out of jail, whether it's on parole or on some kind of wrap up or something like that. They do have programs like that, but they're very limited. And one in particular I can think of is mostly for federal inmates in Boston, and I just think we need more for county inmates and state inmates in the state of Massachusetts.
Awesome. Anyone else want to make a comment? Or?
I'll just say I agree with everything that Keith has said. I think that we could talk probably all night about this issue. I do think that the systems are improving in terms of enhancing the services that are provided, building in more things, and part of that is social consciousness. It's not, I think, been a very it's not been a population that people really want to give their money to or want to talk about helping. People want to talk about kids with cancer, which pulls at everyone's heartstrings, but this is a really needy population. So I think that the more people are talking about these things and interested in them, the more change is going to happen. Rehabilitation should be, in everything they do within these systems, which it currently is not. There's a lot of challenges and reasons for that, and I think we all need to own our role in that in terms of being part of a society that continues to stigmatize people who are incarcerated, people who do have mental illness, substance abuse issues as well.
Awesome. Thanks, Brandy.
Very true. Considering a lot of critique of the prison system, do you think they are equipped and the right people to manage mental health treatments?
I'll take that. I think they would say no, and I think they're probably right. Prisons weren't designed as mental institutions. They were designed, for punishment and rehabilitation around criminal issues, but not mental health is a very specialized treatment. And I think part of how this has all happened is the very well-intentioned deinstitutionalization movement back in the 70s closed a lot of the mental hospitals, which you referred to in your opening. But then the money didn't follow the community programs, and so if you look at the graphs of the populations, you see, institutionalized people in mental health hospitals, they go down, and then the prison population, it goes up. And there's a lot of other things going on at the same time, but you can really see these people, they've just been moved to a different facility that is not designed to take care of them. And I think some of them are trying out some new innovative things to try and take on this mission, but they've sort of become like the provider of last resort. When the communities don't have the resources and the people end up symptomatic and they relapse and they do things that they shouldn't be doing, that's where they end up, and that's where they get care. And sometimes that's the only place they can get care. When I worked in the community, I've talked to people who they ended up in the criminal justice system because they couldn't get their meds any other way. So they chose to commit a crime, to go to jail, to get their meds. And unfortunately, it works. So I think it's a problem on the outside, too, enhancing those services.
And I just want to touch on that, too, since I'm the guy that's been in jail here. But, I mean, I could say for myself that, honestly, like, going away this last time probably saved my life. I think I was probably, a hot meal away from dying. I mean, I was out there on a bad run. And, we would joke around when we were doing time and say, oh, look at so-and-so, he got rescued, because a guy would come in real skinny and strung out from the street. And, it'd be funny and everything, but it was the truth. I mean, and even in the, when I see guys coming in now, it's like, it's sad to see how people are showing up, on their last legs as a result of addiction and mental illness and things like that. So, for me, jail basically saved my life. When that happened, I mean, I don't think I'd be here sitting here today. Obviously, I had to put in action. I had to access the resources to get where I'm at today. And, and I'd also like to say this as well, that the system has changed, and there's definitely more changes that need to be made on all ends, on the mental health, system, substance abuse, judicial system. We all need to improve. But even back then, when I got out in 2003, which isn't really that long ago, there were services available, and that's why I'm here today. I mean, I was able to get parole into a residential treatment center. It wasn't the residential treatment center of my choice, but I was able to get in there. And, and the last sentence that I was in was a 3.5-year sentence. It was a 2.5 with a year and a half. It was in the county jail. And, I was fortunate to get parole and end up in a treatment center. And, and I accessed things like mass rehab, which helped pay for me to go back to school, and that's how I got my license. So I had to, like I said, reach out and ask for the help, and the help was made available. So is it an ideal place, for a person to go and get recovery into, a jail system? No. For myself, am I advocating that needs to happen? No, but for myself, it was something that I had access to treatment out in society, and I wasn't able to sit still long enough for anything to take hold, and I would run out the door and I would get high and subsequently break the law and go to jail. So, it's a, there's a lot, like was said already, we can go all night talking about this, so.
Thank you, guys. So the final question of this segment is, how can Somerville citizens participate to create a positive change?
I have a couple of suggestions.
Awesome.
If you're a business owner, hire people that have been formerly incarcerated. And also check out the DOC website at their volunteer page. They are looking for volunteers across the board. If you like to garden, you can come volunteer with the New Garden Society. Just educate yourself about these issues. I think having these forums is really important for the general public to understand these issues, and that will help with advocacy.
Awesome, thank you.
I'll add something as well. There's a lot of really exciting legislation that's been proposed this cycle, and most of the bills are still in committee, but we have bills in Massachusetts regarding eliminating mandatory minimums, reducing the use of solitary confinement, creating new diversion programs for people with substance abuse, for women with children. There's tons of great stuff, and unfortunately a lot of it just doesn't get out of committee because people, there's no movement around it. The interest doesn't appear to be there. So calling your legislators, going to the hearings, emailing them even. These are all really important steps that you can take to show that you're interested in these issues. And you don't have to be like a rock star on whatever the bill is. You can just go in and say, like, I care about criminal justice reform. These are some things that I hear that you might be talking about. Like, you know, I support it. Can you try and work on these issues? Because your legislators are supposed to be working for you, but if you're not telling them what you want, who knows what they do.
I'd like to also add, I think now is the time to definitely, you know, I think now is a movement where I think this thing is starting to be brought up about, you know, reentry services and about, you know, changing some of the laws. Like one of the things that's in the State House now is about, you know, for drug possession and losing your license, and that's affected, you know, guys are coming out of jail and they're not able to get a license because they have a drug possession, but they weren't in a motor vehicle. You know, so now attention's starting to be paid to that, and hopefully that will go through. So I think on top of that, if you have family members that you know, have addiction issues and mental health issues, is to get education. You know, there's 12-step programs out there like Al-Anon and Knock-It-On. There's Learn to Cope that's run by Joanne Peterson. You know, so it's important to understand what it is that you're dealing with, especially when you have a loved one that you're watching just basically disintegrate right in front of you and not being able to understand and give them enough love to bring them back, you know, and that can actually make, you know, the other person even sicker sometimes than the addict themselves. So, you know, I would definitely suggest to, you know, get educated around it, and I think something like this is great, you know, having these kind of forums and things like that. So
Awesome. Thanks, guys. Okay, so now we're gonna move into the open Q&A. And not to brag, but I've done a lot of Google research on how to moderate these things. So I got a couple guidelines for people so we can try to have the best open Q&A possible. So basically we have 5 guidelines that we'd like people to follow. The first one is do your best to phrase your thoughts in the form of a question. So it's perfectly fine to do an introduction to give your question a little background, but we want the end result to be a question that our panelists can answer. Second guideline is be respectful of the panelists and other audience members. Third one is to connect your question to the topic of mental health in the prison system, because we know this is a huge conversation, but we're going to try to focus on mental health in the prison system. The fourth one is to allow space for as many questions to be asked as possible. So we want to be able to answer all our questions and stay on time, which I think we should be able to do. But ideally, we just want questions that don't need follow-up questions, and we'd like those conversations to continue after this event. And the final guideline is to try to create a conversation that's going to aim and lead towards solutions. So I think how we're going to work this conversation is we'll do hands, and we'll take a question, and then I'll just repeat your question into the microphone. So also, panelists, if you guys think of any questions you want to ask each other, go for it too.
cool.
So start with Jesse.
I'll go first. So this question is for Renee. Renee, one of the questions that they asked you during the Q&A, the question and answer part with them, is what's one of the more sort of rewarding or surprising experiences you had with incarcerated peoples within the program, the gardening?
So just to repeat just the gist of that question, it's for Renee, and it's asking about what are some rewarding experiences you've had within the Garden Society program.
Okay. There's been so many. I'll just start with that. Both Erica and myself had done adult education before working in the prison systems, and found it challenging and not very gratifying working with certain populations of adults. However, once we got into the prison system, we encountered a population of adults that and continue to be the best students we've ever had. They're enthusiastic, they're engaged, they're there on their own will, and the participation and teamwork is exemplary. It's really amazing. So one of the things that happens in one of the facilities we have, I'm not going to name the facility, but you might be able to figure it out once I describe this. We have both patients, mentally ill inmates, and we also have cadres, which are the workforce. And often the cadres and the patients, who are both participants in the program, will be out in the field, and there is more than just teamwork that goes on. There's actually a partnership between patients and cadres, where some of the patients can get a little distracted or lost in what we're doing, and the cadres are there to support them and work side by side with them. So that's been an amazing experience to witness. Also, growing watermelon and breaking it over a bucket because we don't have knives in a garden in the middle of a prison, and then all sharing it and eating it together is one of my favorite memories so far.
Awesome. Thank you, guys. Do we have any other questions out there? Yep.
Hi, I'm a master's in public policy student at Brandeis, and I'm writing a paper about barriers to housing for people with criminal convictions. And I'm wondering if any of you can speak to that. And I think it also relates to people with mental illness leaving prison, and prohibitions against people with criminal convictions living in public housing and things like that.
All right, so I'm gonna do my best at paraphrasing that. So the question is addressed to the whole panel, and it is asking about barriers to housing for prisoners and people with mental illness.
I'll start that answer. I don't have the full answer. I do know that, like you described, public housing projects don't allow people to live there if they have a felony conviction. And it's not just like, be the person on the lease. Like you're really not even supposed to technically, I believe, like sleep there. Also, if you have a sex offense conviction or an arson conviction, good luck trying to find somewhere to live. Most places won't take either of those unless there's a specific program for sex offenders. I've never heard of a specific program for arsonists. There might be one. Those are two really big barriers, just like structural issues, like, that are going to kind of block your entry somewhere. Besides that, there's the whole litany of other issues regarding, I think a lack of services in general. Like there are programs, and a lot of them are really excellent, but there's just not enough. It can be really hard, especially in certain areas, like out in Western Mass, like kind of in between Fitchburg and Pittsfield. There's a lot of people who release out there, but there are almost no programs that are aimed at this population. So that can be difficult. People generally want to live near family, but if they can't live with them, perhaps for one of these other reasons, they're going to want to find a program that's going to take them near them, and that's really important to be able to be near your support system. And if you can't do that, then that's going to be hard. I don't know if anyone else can add more.
I think you got it.
Okay. Thanks, Brandy. All right, we can take more questions. So start with Sassy.
So yes, my name is Sassy, and my question, I'm not sure who I think it's for all of you guys if you have an answer to it, is I'm just curious to see the prisoners or the inmates, is there any type of like activity or events that is held for them in the prison to kind of go at this mental health issue in a sense? Like, is there any fun, creative things that they're able to do or express themselves with, like music or art or things like that they can use to kind of get better in being in prison?
Awesome. Thanks, Sassy. So the question is asking about what activities are there or events inside prisons that deal with mental health or offer opportunities for music, art, or things like that.
I could say for the jail that I work at, there actually isn't an art class that we have once a week, and there's music and things like that, and and they love that stuff. And it's funny because I walk into the room and they have like Miley Cyrus on or something, and they're coloring, and I'll joke with them and say a bunch of hardened criminals in here, But yeah, no, they do that. They love that, and we have classes on the unit that I work on is a drug unit, and we have classes all throughout the day. I mean, it's almost like they're in college. There's they have Think of a Change, Living in Balance. Houses of Healing, the relapse prevention class, aftercare class. So they have classes that they are at all throughout the whole week, Monday through Friday, in activities and stuff. We have a wrap up on Friday at the end of the week, we have a wrap up at 1 o'clock where they go around and give like a they'll say something that they learned throughout the week and a positive affirmation, and then they can give like a shout out to one of their friends, and so yeah, it's definitely come a long way. I mean, they have like where I work, it's like cutting edge. I feel like they have smart boards and stuff like that in the classrooms that that are used. I didn't even seen a smart board even at my college, so they're ahead of the curve. So you're welcome.
Do you want to add? Sure. I think the answer is this is sort of the gold standard, which does happen in a lot of places. And then there's, depending on where they end up, it can be very limited. So like the further up you get in the security level, the less access you're going to have to fun stuff. They're not going to let a guitar in the maximum security prison because it's a safety issue. Same thing with, even like colored pencils can be a challenge sometimes. Usually within treatment programs, there's pretty good access and they can work around things. And then for general population, it can be more limited. I think that guys can buy coloring books through Amazon and colored pencils through the canteen. So even just like on your own, if you have the will to buy those things with your limited resources, I think you could, even in the most restricted area.
I'll just say that one thing that I learned when I started volunteering in the prisons was that there is programming that happens that's brought in by the director of treatment, such as the programming that I provide. And then there's also programming or educational opportunities within the school, within the prison. So, and again, like as Brandy said, like it's really, a lot of it is circumstantial on the security level of the prison and what resources can be brought in.
All right, thanks everyone. So, sorry, right over there. Yep.
Okay. So Keith, as you've been talking about, my name's Dan, as you've been talking about the prison system serving as somewhat of a last resort in some instances around using addiction, and I was wondering if other models like what's happening in Gloucester currently with the Angel program in different areas of other resorts maybe being brought in, what kind of opportunities you see within the community of Somerville that could be used as additional resources than the last resort of prison. So like what areas could be strengthened within the community specifically?
Awesome. Thanks, Dan. So to paraphrase the question, it's asking Keith for his thoughts. He commented earlier about how prison can be a last resort for addiction. And the question is, are there opportunities in Somerville and in this community to strengthen other opportunities so it's not the resort, so people don't have to resort to going to prison?
Right. I worked full time prior to going to the jail at Men's Addiction Treatment Center in Brockton, which is a Section 35 facility, which is a civil commitment, and this is something that's, I think it started about 4 or 5 years ago. I mean, it's been around for a long time, but now it's actually out in the not private but nonprofit sector where a facility like a High Point facility has it rather than Bridgewater. And Bridgewater still has a Section 35 as well. But anyway, so if a family member or a spouse was to go into the court and, say if someone was actively using, they were concerned for them, they'd go and they'd bring them into the court and they would see a psychiatrist and get evaluated and then get sectioned into a facility. And it's up to 90 days. I think that is definitely a much better alternative to, going to jail and, getting treatment. As far as what Somerville could do directly, I mean, it would be great to, I know that Somerville has a residential treatment center. I think having more, treatment centers and things like that, kind of like what I said earlier, reentry programs and those kinds of things, but actually like on the front end and on the back end. So a lot of that I think would come down to, our lost, legal system and things like that, though.
Can I just add one thing to that? So I don't know all the details, but one of our colleagues who does the Handiworks program at Pine Street Inn. I know the last time we spoke, he was talking about doing some vocational training with people that were coming back from drug treatment facilities. And so just like people coming out of jail, people that are coming out of recovery, having vocational training and having job opportunities is going to allow them to be better supported. So this was an initiative through Pine Street Inn Handiworks, and I want to say the city of Somerville. Jesse's giving me the nod. Yeah, so I'll just go with that. So if we can encourage our city to make more of those relationships happen.
Awesome. Thank you. All right. We can take another question. I see Danny.
Yeah, one of my best friends is a paranoid schizophrenic, and he's been locked up in Billerica for quite some time now. He finds himself in the hole pretty regularly, so I wanted to see what actually is being done around solitary confinement, because someone with paranoid schizophrenia, he's not in Bridgewater, he's in Billerica, and he continuously finds himself in the hole despite the fact that he's schizophrenic. And I think that's like the worst place for him to be. So I want to see what actually is. I heard that there is a lot of reform going around solitary confinement, and I was glad you referenced that. Can you speak specifically about actually what is going on around solitary confinement?
All right. So to paraphrase the question, Danny had a friend who is a paranoid schizophrenic, and he is wondering what is being done around solitary confinement.
I'll answer that. So the Houses of Corrections and the Department of Corrections and the Federal Bureau of Prisons and the DYS system all have their own policies around putting people with mental illness into solitary confinement, or what they call segregation. I believe that the Houses of Corrections are the most unregulated or kind of maybe least progressive on the issue, partially probably because they're they all operate their own facility, so they're not as well organized. So this law that is currently in committee is proposing to have a statewide rule and policies regarding who can be put in solitary confinement. So they have very detailed, it's really long, really detailed description of how long anybody can be in there. They want to limit it, I think, to 15 days. And then what to do with people who have what they call serious mental illness, which is a legal term that they use in this state. So someone with paranoid schizophrenia would fall under this category. So they would be provided with additional mental health services while in segregation. Unfortunately, the situation you describe is actually really common because people with psychosis or very severe mental illness have a really hard time following the strict routine and rules and regiments in these facilities. So you can go to solitary confinement for something as simple as like not going in your room when you're supposed to lock in. You'd be out of place for maybe talking back to somebody when maybe you're just screaming at voices. So pretty minimal stuff can get you in there. And then once you're in there, I would also agree with what he said that solitary confinement is the worst place for someone with severe mental illness, which is why these laws are sort of gaining momentum, because there's been a lot of research around how it basically induces mental illness. And if someone already has severe mental illness, it makes it much worse. So there was a public hearing, maybe 3 weeks ago at the State House, and this was one of the bills that they were hearing. And there was a huge amount of support for this bill. The hearing went from 1 p.m. to probably 8 o'clock, and 80% of the people there were 50 bills around that you could talk about, and about 80% of the people were there about this particular bill. So there's a lot of movement around it. A lot of people are really passionate about the issue. There's a lot of groups organizing around it. Jobs Not Jails and EPICA are really involved in this. The bill is sponsored by Prisoners Legal Services. It's not the first time that they have put a bill through. They put a bill through about every year about this issue, and it gets a little bit further each year. Hopefully this year it will get farther. It's a really really important issue. So I'm glad we got to talk about it more.
All right, thank you. So we can take another question. I see Stephanie.
Hi, I'm Stephanie. My question is piggybacking off of Danny's. So when an inmate is in solitary confinement, what mental health treatments are offered to the inmate after they get out of solitary confinement or during, like while they're in there? I had one of my family members was incarcerated and he was in there a lot. So I would want to know like what is offered to the inmates because that's serious.
All right, so this question is for the whole panel, and it is kind of in addition to Danny's question, talking about solitary confinement, specifically what treatments are offered to patients in solitary confinement.
I can start this one off too. So it depends where you're at. So I can't speak too much to the jail system because it's so different, but within the Massachusetts Department of Corrections, there's kind of two levels of solitary confinement. So there's segregation that you would be held in within whatever facility you're living in, like a medium or a maximum facility. And then there's what they call the Departmental Detention Unit. So that is a segregation-only facility. So that's for people who have committed very serious infractions while incarcerated, generally things that would carry like an additional charge, but not always. That's kind of the idea behind it. So just in general, sort of the basic solitary confinement, before the person is taken there, they're evaluated, they're screened by a nurse and a mental health professional. If they do not appear safe at that time to go to segregation, then they will put them on a mental health watch. But that's a temporary situation, and whenever that is resolved, they go to segregation. While they're in segregation, they are required to do rounds twice a week, and that consists of a mental health professional walking up and down the tier to everybody's door. They're supposed to ask how they're doing. If they want to talk more, they pull them out to the visiting room where they would have a session, which is, private, not opposed to like standing at the person's door where whoever's around can hear. If they are someone who's been designated as having a serious mental illness, which would be something like bipolar disorder, schizophrenia, schizoaffective disorder, or they have a functional impairment related to whatever else is going on with them they've been kind of marked as being really vulnerable at risk, then they're required to be seen once a week by their clinician. If they're in these residential programs, then they have to be seen twice a week. If someone has a serious mental illness, they're not allowed to go to the disciplinary detention unit. They go to a diversion program, which is a treatment program instead, for the duration of however long they're supposed to be there. And I believe that the disciplinary detention unit has similar protocols around the rounds, and they have a whole mental health team there too. And I think they just see them whatever they're scheduled at, whatever their cycle is, their treatment plan dictates, unless they identify themselves as needing to be seen. And within the Department of Corrections, at any time, an inmate can say that they're in a mental health crisis, and they're supposed to be seen immediately.
Awesome. Thank you, Brandy.
I don't know if you guys want to add about the jail system or...
I mean, I speaking from my own experience, the longest time I was in the hole consistently in segregation was 30 days, but I didn't speak to anyone afterwards. But again, I wasn't requesting help either. And from what I see on the end, from where I'm at now, if I can think of one person in particular who came in and, he had some mental health disorders. I don't know exactly what his diagnosis was, but he was acting up, and they treated him at this particular facility with a lot of compassion, and they worked with him, and they understood the medical department, the mental health team, they understood that, he was limited and that he had some issues going on. So, yeah, as far as the policies and things like that, though, I wouldn't be able to say exactly what the jail's policies are.
I will add one other thing that you just reminded me of. So the Department of Corrections, it contracts with different providers, different vendors to do different services, and not through their mental health contract, but through their substance abuse contract, which is kind of a little bit broader than just substance abuse. They have a new program for people who are coming out of the disciplinary detention unit to help them reintegrate into prison life. And that's like, I think it started in the summer. so they're trying to start addressing that.
Thank you. And sorry, I see in the back. Yep.
So it seems to me that the idea behind putting someone in jail is to rehabilitate them from whatever. As someone with a cousin who is really messed up, my father was alcoholic, drug dependent, my mom's brother following suit. Why is it not addressed initially when they're incarcerated that they aren't in fact dangerous, but because of a loss of control, these 3 people in my life lost control of their life. They feel like they're just subjected to whatever else, and they end up in the system. So like you were saying before, colored pencils are hard. Why are they not identified as not risk and like treated like they need to understand that their life is in their hands? Why are they not? That's a huge amount of people. Knowing so many people. Another one of my friends, 15 years a heroin addict, falls asleep in his car with a needle in his arm, you know, and then his parents bail him out. Why do they not start there? Like, our system is supposed to be, you know, innocent until guilty. Why don't they start there? With the people who really have just lost faith. That's a huge amount of people.
Good question.
I mean,
All right, thank you. So I don't think I'll be able to paraphrase it amazingly, but you'll see through the answers, kind of get more of an idea of it. But the
generally for Keith, but if you guys have anything to say, great. I just, these people have been in general, I'm curious.
So, yeah, it's directed to Keith initially, and it's about kind of the philosophy of rehabilitation and why people are treated the way they are in prisons and why it seems that there's kind of a lack of understanding about who they are. I think it's how I can paraphrase it.
Well, first off, I'm sorry that you have all, that going on with your family and everything. I would say that addiction is so tricky and so complicated that there's not one solution for every person is so different. I mean, you're dealing with so many different dynamics and belief systems and cultural backgrounds and economic backgrounds and levels of addiction and so it's in age and all that stuff. So it's hard to just pinpoint one solution to that and say, okay, this is what we need to do and this is what needs to happen. As far as, depending on the charges that, that the people are picking up, I mean, and what gets them incarcerated. So it's, I know from my own personal experience that, I started off, my adult record, my adult career, criminal career, being caught for, alcohol possession and Class D possession and then, a stolen car a month later and, I went into jail and I was offered probation. I was offered to go into, residential treatment and things like that. And I actually did go into residential treatment and I didn't follow everything that I needed to do. I stayed, clean and sober for a period of time and went back to using because I didn't address everything that needed to be addressed. So you're dealing with a lot of different factors. I mean, it could be, denial. I see a lot of guys come into the jail and I have a lot of friends that are still incarcerated that is, and so I understand the pain that's behind that and the confusion because it's like, well, why can't we get these people, better? Why can't we, why does it have to be like this? And I have a lot of, clients that, for instance, I could think of one just recently, a very likable guy, you could tell he had a good heart and he did want to do certain things, but he wasn't willing 100% to do everything. And he was being offered programs getting out. And I would sit down, I would talk to him, and he had like one program in mind that he wanted to go to. And it's, it doesn't work that way, unfortunately. And we couldn't get him into that one program. So we had other programs to offer him. He said, no, I'd rather go out and go to a homeless shelter. And so what he would tell his family is going on, I don't know. I know what he was telling the other inmates that, so-and-so wasn't doing their job or, they couldn't get him this and that. And, and I can just speak from my own personal experience. Like, when I was using or when I was caught up in addiction, it was all about blaming other people, for what was going on with me. And I'm not saying that that's what's happening.
That's what any addict does.
Yeah, and and that's what I did. It was someone else's fault. If I wasn't here, if I was out here 5 minutes early, I wouldn't have got arrested. You know what I mean? Or if this cop didn't have an attitude, I wouldn't be here. Or if this CO didn't like me, I wouldn't be in the hole. It was always someone else's fault. The judge didn't like me. This didn't like me, and I had this victim mentality for so long that it was hard for me to see the truth right in front of myself. And it wasn't even that I wanted to live that way. It was a mindset that I was in. So I don't know if that answers your question as much.
If I can, I think my question more is about why don't they, like, for example, you have a job in jail. Why is it not recognized that the people in jail need to use that, like, those experiences are their job? Like, rather than my father cooking in the kitchen the whole time, maybe it should be sectioned. Why is it not dealt with in a more, like, acute manner? Why is it not, like, this is the problem? Like, why is that not the way it's handled? And yes, it's frustration. It's very personal.
Right.
But
Of course.
that should be what they're there for. That's the whole fucking point. Like that, to fix them, to make them not a threatening person, right? So, but why is it not handled that way?
Okay, thank you. Yeah, so just first off, we can just keep the language. No problem. Just we want to keep it respectful. So it's kind of a follow-up question specifically about recognizing jobs in prison and why are they not treated as a way for rehabilitation is how I interpreted it.
Well, first off, I'll say that it's a miracle that I haven't sworn yet. So,
yeah.
Unless I have. Sometimes I might have been unaware of it. Well, I could say, when someone comes in, they do an intake and they assess their needs and, substance abuse related things like that. And so they're offered, for the most part, I can speak about where I work at now. I know that they're offered treatment. Like I said, there is a drug unit. There's also a program called RSAT, which is Residential Substance Abuse Treatment, which is a grant from the federal government. So it takes inmates from population and they have classes just the same as, they have anger management, they have science of addiction, coping, think of a change, all these different classes, relapse prevention. I actually do a class with them as well. And so the option to go into these services are there. The thing is when, and I'm not sure exactly the mentality, of your father or uncle or whatever. So, but I can say for myself and what I see, there's a culture in jail. There's a social environment. For instance, if I reach over someone's tray, that's like a violation. I could get into a fight over that. So there's a certain amount of defense that you have to put up and a certain amount of facade. So it's not like a place where you can go in and say, I really miss everyone and cry on your cellmate's shoulder. So it's, there's a lot of fronts going on. There's a lot of masks that people are wearing, and because of that, there's a stigma attached even amongst, people with substance abuse disorders, mental health issues in population about even going to a drug unit. They're looked down on. So sometimes, guys don't want to go. They refuse it. They'd rather go to the kitchen. Maybe they don't have, enough canteen, so they can supplement their food intake by working, in the kitchen or something like that. Or they don't want to be judged by their peers, or they want to uphold some kind of reputation. And so it's hard to say, but I can tell you at the place that I work at, in places that I've been, that it is offered. Substance abuse treatment is offered, and the help. It's not required, but I've heard of guys being told you're going to have to, you're going to go to the drug unit, guys saying, well, I won't go. And they're like, well, you're either going or you're going to the hole. And so they'd come, and they'd stay on the drug unit. So that's not always the case, but once in a while that will happen. If they get classified to go to a certain unit and they refuse, a lot of the times they'll end up going to segregation for refusing to move. So for the most part, they're going to have to go. So, yeah.
Awesome. Thank you. So, let's see, Stan.
It seems to me that there's kind of different things happening in different parts of the system. Several of you said that. And getting a handle on where things are, kinds of things that you're talking about, with the range of services and the smart boards and all that kind of stuff, sound like great, essentially. But my understanding is like a place like South Bay, that when people come in there, and maybe this isn't true, and I guess that's my question, is this true or not, that when they first go in there, they're held for 23 hours a day before they get into the general population. They hold them for a full month in 23 hours a day lockup. And that's everybody who comes in there. So they're in a cell with 2 or 3 other inmates for a full month, which seems like cruel and unusual punishment just to begin with. And then backing up from that, what they do in police stations, right, before you even get to adjudicate it, those little, tiny little cells, airless little things that they keep people in the basements of these, when people are in the most distress. I wonder what your thoughts are about that and the whole sort of difference, these county jails. Any comments on that?
Awesome. And to paraphrase that, I'll start with talking about the range of services between different parts of the system. Specifically, is it true that in some spots people are held for 23 hours a day for a month-long period?
Well, I mean, I could say so I'm contracted into the jail. I don't work for the sheriff's department. I work for an agency, a nonprofit agency. So I'm not exactly sure how I don't believe there is a new man, at the jail that I'm at. They get classified right away because it's a smaller jail. At some of the other jails, they have different policies, just from my experience, whether or not, some places will hold you in what they call new man for a period of time, and what the reasons are behind that, from an inmate's perspective, was just to weed out, who might have drugs on them coming in, or, and trying to sort things out, where to classify a guy if he has a problem with these guys or whatever. So it's definitely not a fun thing to be, a 23-hour lockdown, that's for sure. And, as far as being in the police stations too, no, that's no fun. It's often sleeping on a roll of toilet paper for a pillow. And so it's definitely, I think, it would be great to have services right away when guys come into the door, and to see, a mental health clinician, a substance abuse clinician, and to have some conversations. And I believe that some places you do actually meet with mental health clinicians and things like that. So, but I'm actually not 100% sure about that, so I don't want to speak on it too much. So, I don't know, maybe if...
Yeah, I can't speak too much to the policies of any county jail, much less a particular one, but I don't think it's uncommon to be held in, what Keith described as a new man's unit or an orientation unit, and usually the purpose of that is they don't know where to house you safely. And unfortunately, a lot of times situations like that or solitary confinement can be used for the person's own safety, especially if there's someone who is very young, or who is transgendered or homosexual. They're often concerned about putting them out there somewhere where they're going to interact with a lot of other inmates because they're worried the person's going to be victimized. I mean, this is sort of a different form of victimization to isolate someone, but there's, I think, really don't have a good solution to the situation and how to handle these things. So that would be my guess as to perhaps why something like that might be happening, which is kind of seems bizarre on the outside. You don't really get it. That's all I can say.
Thanks. And then just another part to that question, if any of you have knowledge of kind of an overview of what happens in police stations, and then thoughts on that.
Just like I said with the toilet paper thing.
Yeah.
That's as much insight as I have on that.
Yeah.
That's about as good as it gets.
Yeah. All I would say is I think that they're even less regulated than county jails. You never know what you're going to get from what I understand.
Well, the stay is so minimal, they're not going to have services for them there.
Right. I would not expect services at any of them. In terms of accommodations, that's probably rough.
Awesome. Thank you. And I have a question for Renee and to all you too. We talked earlier a little bit, I think you talked about, Keith, the culture around mental health in prison. So if you guys have any experiences or stories that kind of speak to what the culture is for inmates around mental health.
I mean, you want Renee?
No, you go.
Go
You
for
want me
it.
to go first? I don't want to hog the mic. The culture, as far as how guys are treated amongst their peers and things like that. I mean, it's I think it's different in every setting. What I found is when someone has severe mental health issues and they're incapable of like really functioning cognitively, I've seen from my perspective, I mean, sometimes guys can be victimized and made fun of and toyed with and played with. For the most part, I think that the mentality is kind of protect the weak in a place like that, amongst some of the convicts and things like that. So it depends on where they are and and who's around really. So I mean, like I said, I've seen one guy recently, and he was definitely suffering from some mental illness, and guys would look out for him and make sure that he was up on time to go to the classes and things like that, and kind of worked with him, and so no one was giving him a hard time, and they were, at least in front of us, this is as a professional, they were helping him out and doing things like that with him. So.
Awesome.
Yeah, just to piggyback on what Keith said, I know that I talked a little bit before about the relationship between Cadres and Patience, and that extends beyond the garden as well. They have mentor programs there, and they have other programs. The name escapes me now, but I know there's an opportunity for cadres to work with individual patients on academics and life skill stuff, help them with their antisocial behavior and so on and so forth. So, and then some people are just like everyone else, and they're annoying, and there's different personalities. So I mean, like it's not so much based on someone's mental well-being, but more so like the personalities that work well together and the personalities that don't.
Thank you. All right, so yeah, we have time for, I'd say, 2 or 3 more questions. So.
I'm sorry, I know I already asked a question, but I just have to ask this one. So, we're getting a definite perspective on Massachusetts prisons. I know you can't necessarily speak to the prisons nationwide, but I don't want people to walk away. Like, it sounds like there's a lot of great programs, and we are probably lucky to be in Massachusetts in a lot of ways. In a lot of ways, it's probably a long way to go. But Keith, in your experience, behind bars, I mean, like you said, the help was there, but I'm sure that there was a lot of like prisons no walk in the park. I mean, can you just speak about some of your experience as prison being a really hard place to live? Losing your freedom and such.
All right. So just to paraphrase that a little bit, it's the question's directed for Keith, and it mentions that we've talked about kind of the opportunities and what is available and the resources, but more specifically, what does it look like day to day inside?
Yeah. I mean, based off my experience, I think I said it earlier. I welcomed a lot of the problems that I had. I mean, it was never fun. It wasn't the place to be. It's not a vacation. It's where I would go and do time. I mean, programs were offered to me in the beginning, and a lot of the times I just refused them. I remember when I was doing time, there was a drug unit. It was called the Mods, and we were still smoking at the time. And in the Mods, you couldn't smoke cigarettes. So I was like, I'm not going up there. And I was content with staying behind the wall and hanging out with my friends and other kids from Somerville, and we play handball and so I kind of fell into that mentality of being on that level where I was just and it was a state of hopelessness, you know what I mean, looking back at it. I mean, I couldn't see myself stopping using, and so I kind of expected to come back to jail, and there would be times where I would be using out on the street, and even though jail was a miserable experience for me, I would, in the back of my head, I was so caught up in addiction, I couldn't stop. And I was just like, man, I can't wait to get arrested, because the only times that I was clean is when I was incarcerated and I was hanging around my friends. Like, the only time I was laughing or joking or doing anything like that or reminiscent or even being accepted. When I would go into jail and I had a charge like an armed robbery, it was like, oh, he's back. And, and that was a beautiful thing. And, when I go out into society and say, oh, I got an armed robbery charge, people aren't trying to hear that. So, I was accepted and things like that in jail. So it was, was it a cold, hard place? Yeah, I got in a lot of fights, and and where I was at, I was, like I said, I was in a hopeless place. I didn't see anything beyond that, and and I'm fortunate that at some point I did mature out of that. When I was doing time, I was young, and the last time that I used, I was 25 years old, and I was still incarcerated, and science kind of explains how in a young male that the frontal lobe doesn't fully develop. So I was I had a undeveloped frontal lobe for years, and maybe that contributed to it. And then at some point, I just kind of matured, and I got to a place where it was like I didn't want to do this anymore. And I also want to add this too, is that when I did get to that place where I decided, I wasn't going to use anymore, and I wanted to do something different, because of my institutional record, I wasn't allowed to go to another unit because, guys would go to protective custody and go to that unit. So now I was in a situation where I was stuck in the place I was at because of my actions, because of my decisions. And at that time, I remember thinking, well, what's the point then? No one's trying to help me out, all this stuff. And I had to get away from that thinking. And there was a small class that used to meet in the place I was at, and out of 400 inmates, me and one other friend of mine would go to this class, and there'd be like 4 or 5 guys in this class out of 400, because it was during yard time. No one wanted to go, but it was available, and there was literature available, and I got a basic text when I was behind the wall, which is an NA piece of literature, a 12-step fellowship literature, and I would sit in my cell, and me and another young kid from Somerville, and I'm like, listen, we're going to start reading this book together, and then we're going to share on it. We're going to go paragraph for paragraph, and we're going to have a conversation. He's like, you crazy? And so I did what I had to do to get out, and I had to accept the mistakes that I made brought me into the places that I was in. And ultimately I had myself to blame, and so I had to accept that. I had to accept some responsibility and move on. So to answer your question, yeah, there was some hard times, and there was some cold times, and there was some people that definitely didn't care, and I was one of them that didn't care, and it wasn't a fun place, and I just thank God that I made it out of it.
Thank you. So, Marco?
Hello. I guess this question's for all of you. I know there's a lot of programs in the prison system right now going on, but you said sometimes you didn't feel like you wanted to go to these programs, and you feel like sometimes certain prisoners don't want to participate in these programs that you guys do offer, or the prison system does offer. Do you feel like it should be mandated for certain prisoners that are having a lot of issues in the prison system or around mental health?
All right. So to paraphrase that, the question was to the whole panel, and it references how we've talked about programs in the system, but specifically how there can be a culture where inmates don't want to go to the optional programs. Should those programs be mandated?
I'll just say that some are mandated. So if you are acutely mentally ill to the point where you require inpatient hospitalization, you will be mandated, you'll be moved to the hospital where there's hospital-like programming. There are the residential treatment units, the philosophy behind them is that they're voluntary, but there are some people who essentially get mandated. They're people generally who their functioning level is so low that it's not safe for them to be living in population, and their insight is also so poor that they're unable to acknowledge that they should be at in the mental health unit. We can't make them go to the group. We can't make them come into the individual therapy session. But once they're in those programs, there are incentives to try and get them to come, whether it's because they want to help themselves or they want to earn some points to buy some potato chips. There is a budget through the inmate benefit fund that funds these sorts of things, incentives for programming and other things. So that's part of how we try and get them in the door. Some guys want to participate in programs just because there are other incentives, like some of the programs have single cells, and so that might be an incentive for someone to go there. Some of those things are intentional, some are just sort of byproducts of the way things are set up. The incentives definitely help, but at some point they need to take ownership for their treatment, or they're not going to actually improve or get a whole lot out of it. Usually after they show up for the candy bars a few times, they're like, this is actually not so bad. It's better than sitting in my room. Or a lot of guys say they just want to go see a lady, because a lot of the providers are females. So that can be an incentive.
Awesome. thank you.
Yeah, I would say, I think it starts really in the court, and putting that as a stipulation, as far as, this, if we're gonna give someone time, and this is something that I would like to see, and it's something that's been talked about when the Corey reform was going on, and back in 2008, they were talking about this, and I think part of it, goes along with drug court, like the idea behind drug court is, if they're gonna give a guy time, stipulate, say if they're going to give someone 18 months, instead say, okay, let's give this guy a year, and, he has to complete a drug program in the jail, get the certificate, and then also be released into a halfway house. So kind of split the sentence up. As far as how it is now, as far as guys coming up on parole and things like that, a lot of the times they'll tell them, well, you need to complete a drug program, or with classification, it's especially if we identified someone as, having a substance abuse problem, then they're going to say, well, listen, you need to complete this drug program before you move down to the minimum security facility and pre-release and things like that. So I think for the most part, it's something that it's definitely encouraged if guys want to move forward, if they want to, get the step downs and things like that. But, like I said, too, some of them don't. Some of them don't care. And so are they made to do it? No. Do I think that would be a good idea, like forcing them into it? It's kind of a double-edged sword. I mean, because if it could cause more problems on a unit, it could disrupt it for maybe, some guys are really trying to do it, and then, so it could go either way, so it's hard to say for sure.
Thanks a lot.
Mm-hmm.
Awesome. Thanks, everyone. So we're going to close out this section. If you guys have any kind of final words, you want to talk about something we didn't touch on, this is the chance.
I'll just say one thing. So we've been talking, about the inmate experience, but I think a big piece of what goes on in the system is the staff there, so the correctional officers. And they're actually also like a really needy group. A recent study showed that a third of them have PTSD, which is on par with combat veterans. So when you think about like the people who are, taking care of these inmates with all this huge litany of problems, have all these problems of their own and their own stigma in accessing services, I think you can kind of see, a big picture that the system is really broken on a lot of different levels. And so that's just a whole nother issue.
Thank you, Brandy.
My mic still has smoke coming off of it, so but I thank you for inviting me here.
Yeah, I totally agree with what Brandy has said. In a few of the facilities that we work, we hear how difficult it is from the staff, from the correctional officers and the rec officers that we work with. It's really, really hard to do your job when you're understaffed and there's no resources. And you don't even have a telephone line or internet connection or like these basic things that people would need. You don't have training to deal with mentally ill individuals when you're a rec officer at a mental hospital. So there is a lot of initiatives that can be worked in that area too. Yeah.
Awesome, thank you. So I'm going to pass it off to Olivia to close us out here.
Thank you. Thank you guys for coming. Thanks for the questions. Thank you to SCATV, our partners, for this space. And thank you to the panelists for offering such insight on this very important topic. Yeah. Thank you, Somerville Overcoming Addiction, for being a great resource and partner on this project. I think this really gained a lot of perspective on what needs to be implemented and what's going well, because I walked in here, I didn't know there was so much going well in the prison system. And I hope that tonight we can leave with a wider viewpoint and an open mind and learn a creative way to make change on mental health. So after this, there's going to be some evaluations for the event.
Yep, so we have, I think some of my coworkers are back there. Pat and Steph are going to have clipboards. We do evaluations so we can try to improve these events, make them more impactful, make it a wider scope. So we really appreciate it if you could fill out those evaluations, and they'll probably find you on your way out. And thank you guys all so much. This was a great conversation. Appreciate it.